Time now for this week's Health Matters. PA Lynn Szabo in the house. It's a beautiful day outside. I'm looking forward to going out and going for a nice sort of nature walk, kind of nature bathing outside, which is basically that and cannabis are basically my mental health strategies. Are there other better ways to exist?
Yeah, nothing says mental health need like upcoming holidays, let me tell you.
Oh man, that's right.
There you go. So
have you been? Are holidays stressful for you?
not really.
Yeah, me neither.
I usually fly solo or with friends.
Mm-hmm. It just seems
I
like
go out. I do what you do. I go out and wander in the woods.
Yeah.
Yeah.
People
so-
come to me. I don't. It's just. It seems like I've never. Like it's almost like that's a trope. The holidays are so stressful, and I'm like, for who? And am I doing them wrong? I'm just curious. Am I missing out on some of the high stakes activities?
I think my kids would say it's stressful for them because they have to interact with their grandparents, and for some reason they're shy about that. I don't know why. Anyway, mental health. Let's define it. It has emotional, psychological, and social well-being that determines how an individual handles stress, interpersonal relationships, and decision making. So, actually, something super relevant to Del Norte.
Okay.
Yeah.
I also have a conspiracy theory about mental health and normative mental health, but that's just me.
You mean that it's something that maybe some people put on other people to,
Oh, I think it's entirely
to find an advantage?
No, well,
that-
maybe that. I think it's an aspect. Okay, so we're herd animals, right, or pack
Right.
animals,
Right.
basically, or something like
To
that.
keep everybody in line.
Our ideas about mental health are that to make sure everybody's is on the same page. I think it's another
I think
one.
sometimes, but I also think we used to be, as a culture and society, used to be way more tolerant of people that were kind of on the fringe.
Yeah, exactly.
And, they had occupations like mountain man, so you could kind of disappear into the Rockies for a couple of years
That was okay.
not bug anybody. So
Yeah. I think as we've gotten more complex as a society, there's more pressure for mental health and normative mental health.
Right. And then also when the population goes up, because, if you put enough rats in a cage, they don't like each other and they act out. So,
Right. Okay.
Yeah. But mentally ill people did used to be stigmatized and punished, especially in the name of religion. And they were inhumanely confined a lot of times, in conditions that were pretty appalling. And then Dorothea Dix came along. So shout out to Dorothea Dix in the late 1800s. She was one of the first to come to the national awareness with her efforts to treat mentally ill people more humanely.
I know nothing about Dorothea Dix or her life. I can
She was
imagine.
kind of pivotal.
Because I can
She was a
imagine
paradigm.
no more difficult paradigm to throw yourself into than trying to reform 19th century mental health.
Especially an intelligent woman in the late 1800s, because a lot of intelligent women got the label mentally ill because they were problematic.
Yes, exactly. But also, it seems like a lot of the progress in healthcare in the 19th century were because of passionate, engaged, on the fringe women. Right. From the Red Cross and Clara Barton and what's her name,
Dorothea
the
Dix,
award, Dorothea Dix. All of this, it seems like there was like a kind
lot
of
of women of color whose names we don't really know.
Right, and it seems like there was almost like a void there being filled by humans doing human things.
Right. So, but she set up a bunch of outpatient clinics, over 30 of them, for mentally ill people, but they were still pretty abysmal. Mm-hmm. Even though she advocated for better care for them, they were understaffed. Still, people didn't understand, and people weren't really treated very well. Outpatient clinics came along in the early 1900s, which was a step forward, actually. So somebody could live with their family, be cared for better, and then get health care in an outpatient clinic.
Wow. Do you have any idea like how widespread that was? As
Probably
opposed
depends on where you were.
Sure.
Yeah.
But it depends on because we've all seen, some of those sanitariums or sanatoriums. What's the difference? I forget.
A sanatorium, but okay.
Okay. Well, like one I thought is like for, if you've got mental health issues. This is an old archaic term.
Right.
You got the other one was for if you've got TB and you need a place to be. I thought that was the difference between the two. But a lot of these places weren't really closed. These big, huge facilities weren't closed until like the 70s and on into the 90s too.
Right. Exactly.
Wow. So that's why I was wondering how widespread the outpatient
It's kind of
movement
interesting,
was.
just as an aside, a lot of Native people, especially the elders, have parents who were, I would say, incarcerated because of tuberculosis.
Right.
And a lot of kids grew up in, incarcerated with their parents. So, but anyway, in the early 60s, they created what looked like more local and self-sufficient home health or mental health centers. And then there wasn't too much financial support for that until California did pass an income tax on millionaires in 2004. But that act and that money, where that came from, that changed the focus from psychiatric care to behavioral health care, and this is an important change.
Okay, what's the difference then?
So behavioral health looks at how an individual's behavior affects their health. But it also includes mental health as kind of a subset of it. So, for example, behavioral health could address how somebody's obesity is contributing to their diabetes.
Okay.
Okay, but
Sure.
it could also contribute to how somebody's drug use is making their schizophrenia worse. Okay, so I think the goal is to have more functional people.
What's the difference between that and a more psychiatric approach?
So I was going to define this a little bit later, but I think
Okay, well, we can hold off.
we should understand the players, though. You bring up a good point. So psychiatrists are doctors, so physicians that don't do counseling. They do investigate a little bit about what somebody's life is like.
It's
but
medicine they're basically
they're really
involved with.
looking at symptoms,
Right.
signs and symptoms, and then they prescribe medication. So it's not like Woody Allen sitting on the couch, every Thursday in New York City and kind of spewing his life and
Right.
having somebody go, So I don't think people understand that that's different from psychologists.
Right. I think
So-
people understand it, and only that a psychiatrist can prescribe medication.
Right.
Yeah.
Psychiatrists prescribe, psychologists listen more and give more lifestyle modification suggestions, and then consult with psychiatrists to get people on the right medicine. And psychologists often come to me and say, I think this is the diagnosis, these meds could be helpful. And they're not overstepping or anything. They're just making a suggestion. They are educated people.
Right.
So-
Right.
And then licensed clinic social workers and masters in social workers and psychiatric nurse practitioners are really what we have up here.
And that is a segment of the mental health care pie there that's really, really grown in the past generation or two, hasn't it? That kind of
That goes
mid-level.
back to behavioral health.
Right. Okay.
And these people, I think what the patient wants is a weekly appointment where they can vent. What is on the agenda of these people as they're being directed to by the funders is they want those providers to give concrete suggestions on how this person can improve their life in 6 weeks or less and then be done with it. So super disconnect from what patients feel they need and what funders are willing to pay for.
Wow. So
Yeah.
okay. And in what context does that dynamic play out?
So say somebody comes in and sees me in Saturday Clinic at Open Door and they talk about depression. And so as it is currently, there's no behavioral health component there. So I have to get this person an appointment with behavioral health, and perhaps I'll start them on medication, say they've been on something before, or, Prozac really helped their sister or something. So I can start medication and then I'm kind of done except
Right.
for refilling and the handoff to behavioral health. And they're going to say, if you do 150 minutes of exercise a week, that's been shown to be as equivalent to the selective serotonin reuptake inhibitor as far as treating depression. Okay. But patients don't always, everybody wants what's easy. And so 150 minutes of exercise a week doesn't oftentimes sound as attractive as taking a pill every day. And so it's really, really hard to get people motivated, but that's what the behavioral health people are doing. They're assessing for safety. They're trying to get people motivated and then fixed in 6 visits or so.
You made it sound as if they have like monetary pressures to resolve issues in 6 weeks.
Everybody in medicine has monetary pressures.
Right. But specifically for the funding of this level of mental health care, there's a very tight timeline, and it's very practical sort of deliverable that you have. Okay, so how does Woody Allen on the couch fit into any of this, or does it anymore? Is that an out? Is it okay?
It's not a thing anymore unless I suppose you're a billionaire in New York.
Well, yeah. Well, and you
could buy anything. So is healthcare a right or a privilege?
Well, you have to buy everything in New York because none of the psychologists or psychiatrists there take insurance.
Right.
It's all cash.
Right.
That's okay. Anyway, so that's an outmoded sort of thing. I guess I feel like that's a more involved kind of, like that counselor, that psychologist, that person you can talk to. I guess this is the underlying question that I'm finding out I have in me is then what is mental health? Is it something you can take a pill for? Is it something that you have to work your whole life with?
I think we're finding more and more that it's an evolution and it's something you have to work your whole life with.
Okay.
And people even, depending on what they have, even unmedicated, will eventually grow toward wellness, most people. Some seriously mentally ill people are never going to make those steps.
Right.
But, some people do better when they have a supportive household that's around them, that's not chaotic, that's like their bubble wrap.
Right.
And that can, they're always going to be a little quirky, I guess you could call it. But, if they have a loving, supportive environment, sometimes they can get by with just that.
It's just, I guess, like we've talked many times about how you have to be your own advocate nowadays,
Totally.
right? So is that difficult for somebody who's experiencing mental health issues?
That's absolutely difficult, especially if somebody's acutely psychotic.
Right, and has to be their own continuation of care. How?
Right.
Wow, that's tricky.
Right, and it's also tricky to find. So if in this county, most of those people are being medicated by family practice providers at the community healthcare level, who know a little bit about everything, but not a lot about most things.
Right.
It's really, really hard to be efficient in just giving a pill out and making it all better.
It's really hard to be efficient. What do you mean?
So it's 7 minutes in the exam room.
Gotcha.
I mean, it's unrealistic.
Yeah.
Is what I'm saying.
It just seems like that there are pressures on people experiencing the mental health care system. There are pressures to be let me see if I can say this the way I really mean it, which is something I picked up from Mike, from Mike Thorne. His little tick there, he says when he's thinking, that like you're pressured to be, this is an ongoing thing. You need to work at your own mental health for your entire life. We're going to help you for this 6 weeks. Good luck.
Yeah.
Am I perceiving that incorrectly?
Yeah, that's exactly what I said here. That if a patient, the plan is if a patient could just be shown, I've got air quotes here, a better way, then all of a sudden, like it's never occurred to them maybe to not do drugs because that's affecting their mental health.
Right.
Oh, never thought of that. Okay, I'm on it. It's all better. Thanks. Bye.
And that seems to be a pretty big breakdown in all of this. And
it totally is.
Wow. Okay.
So what they do in the community clinics with the behavioral health people between the regular medical providers is that they do something called a warm handoff. And that's like if somebody comes in a complete panic meltdown, psychological distress kind of thing, we're supposed to be able to call the behavioral health people who have their own schedule and are seeing their own patients and say, this is an acute need. With your training and your expertise, can you please step in and help now? And that virtually never happens.
Wow.
And so the person kind of gets put in a room with a provider that's got 7 minutes. Okay, got people knocking on the door and other people waiting in the other room to try and, address this, calamity. And oftentimes that's where people end up at the ER here, which is even worse.
In the ER for what sorts of
for
like self-harm or
self-harm. If self-harm comes up, to address self-harm thoroughly, you really have to be in the room like an hour and a half.
Right, right.
And it's like talking somebody down, like the old LSD days.
Yeah,
And it
yeah. Or somebody standing on a ledge who's going to jump. You know,
Right.
you don't just have 7 minutes. Well, hope you don't jump. And then
Right.
go, you know.
Yeah, good luck with that.
Yeah, yeah.
So, and oftentimes the behavioral health people who can't sit around and wait for this kind of thing to happen, maybe a once a week thing or once every 2 weeks, they're in with their own patients. And so oftentimes they're yelling advice down the hall, like teach them to breathe, teach them relaxation exercises. None of that is super helpful.
Right, right.
So personally, I don't see it working very well.
Wow, okay, okay.
But there is something that's actually kind of helpful. Telehealth has opened this up a bit.
Mm-hmm.
Okay, so there's a lot of examples where telehealth has really helped psychiatry. So when I worked at Open Door in Arcata, I was working with a physician at UC Davis who's a psychiatrist, and he was actually doing kind of the Woody Allen classic hour meeting with people via telehealth, and it was probably about 12 or 15 years ago. So it was the first time it had
Wow.
ever really been done up here.
Yeah.
And he was trying to do a study to see that it had merit so that they could have their residents who are doctors in training. They're actually already
Right.
physicians. But, open it up for rural communities. And that worked really well. And we do see that sometimes here, like at County Mental Health. And I think currently WellPath in the jail is doing that. And I'll bet you Pelican Bay is too.
Telehealth, Pelican Bay. I'm almost 100% sure that that's no, unless it's changed. But yeah.
All right.
The
Okay.
what's the but you get, I mean, the frequency of those, because I know people who have telehealth psychiatry or counseling, I guess is what it's called, just in general out in the world.
Yeah, that's what patients call it.
And it's like an hour a month.
Right.
So is that enough?
No.
Yeah. Right.
No, not really. So, but there is a better choice actually coming up. It's not really available in my understanding through partnership, but I think if partnership is smart, I bet they're working on something similar. So these are.
Oh, are these like apps?
No, it's a real person.
Okay.
It's.
Oh yeah, no. I know. Okay,
Yeah.
go on. I have things
So
to say.
these are businesses that are online businesses.
Right.
Okay. So I suppose there's an app
Yeah,
component to it.
But you use the app to interface with like
Right,
kind of
right.
real-time counseling.
Right.
Right.
So, but I'm talking about BetterHelp and TalkSpace. Those are the two most popular ones that I'm that I'm familiar with. I don't see it happening up here with Medi-Cal patients, but partnership, if they're smart, they could easily set something like this up.
Do you have any idea how much this costs for
75. I know because I had a family member who went $75 an encounter. And here's what's really good about it. Okay, you're making that's too much money face.
There's cheaper ones out there, is what I'm
Right.
saying.
Okay,
Maybe
that was my experience with my family member.
Okay.
So, but what I liked about it was super available to somebody who needed it acutely.
anytime.
There was a screening process to find a suitable counselor in terms of what the needs were, where the location was, what the legal abilities like to prescribe medication or not.
Right.
Somebody who had expertise in the issues that my family member was having. And she got set up with I thought a really competent counselor who was actually nearby, and they got transitioned into inpatient, or not inpatient, but in-office appointments.
Wow. Okay.
After a certain amount of time on the phone, and it turned out to be really helpful.
Oh man. Okay. All right. And in that regard, like what you've just described, $75. No, you're getting off cheap.
Yeah.
Yeah. No, I've seen there have been sponsors for some of the vloggers on YouTube that I watch, and there was one that was exactly what you're describing, and I don't know what the cost was or anything, but it was like, yeah, you've got an issue, you've got a problem, you can go in, it kind of goes through, and you go through a system, and you're vetted, and you're
Right.
sort of fended off into.
Yeah, if you got trans issues, or you got dying
Right.
parents, or sick kid, or
Right.
divorce, or my boyfriend's mean to me, whatever it is.
And
So.
I think for younger people, that may be very, very beneficial. I know, and I want to talk a little bit when we get to a little bit later on here. I want to talk a little bit about the local fella, and I got to remember his name, who does the suicide awareness outreach every year.
Yeah,
There's a guy.
Brookings.
Yeah.
I don't know his name.
I
but
can't
know
remember
him.
his name. I see him all the time. Anyway,
Definitely
apologies.
dedicated individual.
He was talking about interacting with young people who have, suicidal ideation, and how important it was to do it efficiently in a text sort of way, because young people respond to that. They don't want to talk to you. They don't want to go face to face, but they'll go back and forth with the text. And that's something that he said was very, very helpful. And he has like thousands and thousands and thousands of these interactions that have been, cataloged of, people, young people texting and being much more comfortable with that than some other telehealth kind of scenario.
That's
But
awesome.
what he said about California, and I want to leave this hanging in the end because we've talked about this before, was that because he's from Oregon and he's up there in Oregon, they just don't care about anything. It's like, circle the wagons. We're not paying taxes for anything. He actually said this to me once on the air here. California mental health, what you're doing down there, you're doing it right. And I was blown away. I'm how do you mean? I asked him to, elucidate. I'm not aware of California doing anything right. And then it turns out that no, there's a lot more infrastructure in here, even for the poor and disenfranchised. It's much better for us in California
Even
than it is.
in Northern California?
I think it just in California in general. Yeah.
'Cause I think it's more together in, south of Ukiah.
You think?
I don't
Even
know.
in
I
a
have
rural?
no data to support that. But
'Cause it would seem to me like it's together in all the big blue areas where there's urban centers, and then it's not together in all the widespread red areas where we're rural out here. My assumption would be it's that old divide.
But that's where telehealth could really help a rural community. Yeah.
As well as these online, always on your phone kinds of things that could be, first lines of interaction and help that you'd
Right.
carry in with you all the time.
Right.
Well, okay. Anyway, sorry.
And so the online thing has kind of led to an evolution of group kind of mental health, and payers really like this because then you can get a bunch in 1 hour. You can
you just
take care
pay
of
in one
10
person.
people, and then you said fee times 10.
Has it grown? Is it the stress of the payers, of the funders? Is it also just it seems culturally like the whole because of AA and recovery things, the whole
Right.
group encounter is a little.
That's an example I was going to bring up. So AA online during COVID, I think, really blossomed. And although I don't see it in use up here, I oftentimes recommend it.
There are
if somebody has the computer.
Open Door.
ability.
They commonly, although they do in person stuff, recovery. Some of the recovery groups at Open Door, I know that they do Zoom. They use Zoom all the
Right.
time, and that was something kept them
Right.
going. Yeah.
And so in my research on this, I also found a different online group that was set up by California state educators called CalHope, which existed specifically to help parents with the anxiety of sending their kids back to school during COVID.
Okay.
So these kind of things where people with similar problems are brought together, and maybe with an educated, curator or meeting leader, and to kind of help each other. Again, that's your theory in medicine, is that mostly we're handing it back to the patient, which is true.
Yeah.
And these things I think can be helpful for people who access them. Who it's going to work for anyway.
Yeah.
There are some people where it's not like it would never work for me.
Well,
man.
sure, because abandonment can also be empowering.
Right.
Yeah. Is that?
There you go.
Is that
I've been there
character-
a time or two.
Right. Right.
Yeah. So, mental health options in Del Norte and Humboldt, outside the community clinics, county mental health, and maybe the county jail are pretty meager.
That is really a depressing sentence, but yeah. Yeah.
Yeah. When I'll just put an aside. When Turtle Medicine was in charge of the jail, they had an excellent psychiatrist who actually came and met with people in person.
Wow.
She kind of reminded me
Local?
Yeah.
Wow.
Well, Humboldt.
Okay.
Yeah, but she worked in both counties like a lot of medical providers do. And she just wasn't able to work with the structure well path was setting up.
Okay.
So we lost a lot of really good people in that switchover, and she was one of them.
That's too bad.
Yeah, she was a little bit like Silence of the Lambs, like really interested in the pathology of it. And meaningful treatment.
So, like, not like Anthony Hopkins, but like...
No, she wasn't that one.
She's Clarice. Gotcha.
Yeah,
Okay.
she was definitely Clarice. I'm like, really?
Jodie
Direct?
Foster. I had to remember who was Jodie Foster. Okay, cool.
Yeah.
Okay. So I have, let's say I'm a Del Norter and I'm experiencing difficult times, and I don't have health insurance. This is only going to partially be based on an actual
And you're
actual
not
events.
incarcerated.
And I'm not incarcerated. Like I said, I don't have health insurance. What do I do? Where do I go? What's my first
Our
option?
county mental health. If it's actually, I think.
What if it's Friday afternoon?
I think you're dialing an 800 number.
Wow. Okay.
If you
yeah.
don't have family that can talk to you, and then you're probably going to make a try to see your provider in the community clinic who's going to go, why does this always happen on Friday afternoon?
It's been a long week,
Right.
Doc.
And then the behavioral guys are going to say, no, I'm booked. I can't. Anyway, and everybody's going to try and help a little bit.
Yeah.
Because they do try. It's not that they're like totally oblivious to it, but it's inadequate at this point. And so that person, if that person was in real crisis, they would end up in the ER.
What are we shooting for here? What's the ideal?
I think having like some family bubble wrap around the individual, some clear diagnostic ideas, and medication that's available, that's not price controlled, and is available quickly. So that means the pharmacy is open on Saturday. We talked about that last week. It's getting worse.
Do you need to have a provider who spends more than just 7 minutes with you, who knows you? Or is that something that
has to be the right provider, and that person has to be understand what the goal is. So the goal isn't to get through until 5 on Friday and then go home and try and put psychological bandages on people,
right.
And then hope they're going to be okay when they cycle around in a month. And I think it has to be somebody who can have a meaningful action plan. That's what's lacking. Diagnostic clarity and meaningful action plan are not here because of lack of resources.
Are they elsewhere? Or is the system itself kind of made up of patchwork ad hoc Band-Aids?
I think it depends on where you are. I think at rural communities, it's like little ad hoc Band-Aids. I think if somebody was in San Francisco, downtown San Francisco, Friday afternoon would be meaningless because because Saturday and Sunday are also work days. So, and the pharmacies are also open 24/7.
Yeah.
Stuff like that. There's just more resources.
Wow. Okay.
Yeah.
I'm trying to understand if it's when you were talking about the person who worked with turtle medicine in the jail here, we've talked about this a number of times in a number of shows. The kind of divide between a system that works and on the other end the real exceptional people who make lots of good happen in a lot of other people's lives. And does the system help those people? Does the system hinder those people? Should the system be more like those people, if that's even possible? Can you systematize human interaction like that?
I think the best people, number one, they have the I think the personal buy-in to wanting to help. But the other thing is they're out-of-the-box thinkers.
Wow. Well, okay.
Solutions are possible if you don't adhere to rules. And that's why I personally think PAs are great, because we don't do no stinking rules, in my opinion. I'm like, it's not just me. It's like, oh, I'm sorry you feel that way, but I'm doing this anyway. This is what the patient needs.
Right.
Okay, and so I think the people that are what you're referring to, and I call the one-name wonders, and it's not just PAs. There's also some physicians in the ER.
Mike Henderson is one. They're all around us. Yeah.
Yeah. Shout out to Mike. We miss you, Mike. But he's super busy. He's beyond super busy. And, I hope it lightens up for him a little bit because he needs it. Everybody needs it. But I think that they've kept things going in this community for a long time. But there's other things that we have too. Nature, exercise, light therapy, nutritional supplements. Talk to your healthcare provider for details, but these are all real things. Somebody told me they wanted real medicine, but these are real medicine, okay, guys? And
What are they saying, that we don't talk about real medicine? Or
no,
somebody told
it
you?
was in the exam room,
Oh, okay.
so it was specific to her healthcare. And she wanted an immune booster, so I told her the data, and we've talked about this through COVID.
Go
and
for
she
a
was
walk in
like,
the
no,
forest.
she wants real medicine, and I'm like, no,
Yeah,
not that I know of. So, but we have all those things up here, okay? And so I think a motivated person that has a big problem should be motivated to access all of the resources. That's all I'm saying.
Yeah, but it is up to you, and it is up to you to know where to go first.
Right.
And
Or the family around you thinks of things like this.
Wow. Okay. You know what I think we should? I'd love to do a show that's just nothing but just vitamin D. Because I think I need that.
Oh, I know. Oh, you probably do.
I probably do, right? Yeah, just
Yeah.
look at the map.
Yeah.
Yeah. I think I'd like to know about just what vitamin D can do. More vitamin D.
Yeah.
That's just a suggestion. I'm not making a
Okay.
request or anything with you.
No, I think it's intriguing. I've been thinking about it, actually.
Have you been thinking about it now that it's dark
you're
at
not
5?
asking the right question yet, but we'll get there.
All right. PA Lynn Szabo, thank you very much for this week's Health Matters, and we'll see you next week.